I think I'm going to take a step back a little and talk more about, why do we even care about getting a unified image-enabled care strategy? Who really cares in the enterprise? When I first took over doing medical imaging, it was PACS, and it was strictly radiology. And it quickly became apparent that we weren't providing what the clinicians needed. We weren't providing integration with the EMR. We weren't providing image availability. We solved the problems and went on to enterprise imaging, and I think we forgot to include a lot of people. So I think I'd like to sort of present from the beginning where I think people should go when they're looking at image-enabled care. Enterprise growth in imaging is really a big deal now. I mean, people are starting to think about pathology. Image and data volume is getting huge. And people don't want to be buying a ton of different products. They really want better management of information. They want to be able to get at their images. They want to be able to do it pulsed. They want to be able to go and consume information. They don't care how it's done. Sort of skip over who we are. The big thing is there's a lot of separate islands of information. There's the radiologist, there's a cardiologist, there's a referring physician, there's oncology, other people out there that consume images. And they all center around the EHR. And the problem, I think, in PACS is that we didn't center around the EHR. We also didn't look at things like from chief executives down through individual users, from the very top of the organization to the very bottom. What do each of these get out of doing something good about integrating imaging into the EMR? The CEO, they actually care about really developing the business, attracting patients, prioritizing capital expenditures, and to do that, they really want to eliminate redundant systems. They could care less how it's done, they just don't want to pay for it. So if you're going to be doing image silos, it's going to be bad and your CEO is not going to be happy. So I think you need to make sure you address the CEO's need when you look at how you integrate imaging into your EMR. The CFO is the bean counter that actually has to prioritize all the capital expenditures. Again, redundant silos are not good for his business. The CIO, he's the one that actually, or he or she is the one that actually has to implement it, determine utilization, administrate all the problems, deal with the headaches that Paul does every day, and make sure that you can do all the bits and bytes, make sure that business continuance works, make sure that it scales, make sure that it's cost effective. And then you get down to the point of the chief of each imaging service. They really care just about how does their product look. The cardiologist really doesn't want to, the chief of cardiology doesn't really want to go out and spend $400,000, $500,000, $1 million out of their budget to buy a cardiology PACS. They would much rather have a couple new cath labs and a new CT scanner. So really, you want to try to meet their needs as well. Make sure you give them a product that helps them become effective. Make sure they can manage their limited resources, and let IT support what IT should support, the infrastructure and the image archive. If that's done, you'll actually meet the needs of the individual clinical users. You'll help them get longitudinal access across the patient record. It'll be easy. It'll have one format. They won't have to go into multiple different systems. If you were doing an EMR, you'd never think it would be acceptable to have the user log in one time to see what the lab values were and log out of that system and log back into another to check the stress test results and log out. Same thing with imaging. You want to make sure that they can actually go to the EMR and consume all of the images. And patient needs. Becoming more and more patient-centric, allowing patients to actually consume or at least look at their own medical record. Probably not that important to a radiologist or somebody sitting in a PACS environment, but it's becoming a big selling point. I know in Madison we have some very vigorous competition for the various health plans around, and some of the managed care organizations are very good at making sure patients know how important taking care of their own health record is and participating in their own care. If you can't provide them with good access to their medical record, and that includes imaging, you're not going to provide a full service. So really it's old versus new. You want to get real-time information. You don't want silos of information. You want to make sure that a procedure can be integrated side by side. So when the ENT doc does an endoscopic procedure and the radiologist reads the procedure, they're available to look at side by side, so you're not calling a patient back telling them they might have a cancer, when in reality it's only a simple polyp that was imaged a month ago. And you want to make sure you look at the other sources of image data. They're spread across the whole enterprise. Don't treat any of them as an individual. Make sure you manage all the images together. One of the biggest areas, at least at our tertiary care site, is oncology. We have multidisciplinary conferences in virtually every area, and they're very image intense. Being able to have pathology with endoscopy, with radiology, all sitting side by side in a patient care conference really helps provide better patient care. Standards, I think, will help fuel adoption. They're good edge protocols. I'm sure Paul will get into this a little later. IHE has some very good integration profiles. It provides a good framework for vendors to hang their hat on. It's not everything. It certainly won't be plug and play. But there are at least the standards that are out there that allow things to interoperate at the edges. You need to make sure you manage the information, be willing to share, and develop an enterprise imaging vision that allows all people to see one unified view of the world, basically the EMR-centric view of the world. I think I'll try to stop there and let everyone else get moving.
Okay.